instruction. Together with me, I have Sergeant Smith, as he's going to be my demonstrator and my assistant instructor for M7. All right, so for M7, you're going to know how to apply an occlusive dressing, perform needle decompression, measure patient pulse oxygen saturation, and record treatment on your teacher proceed card. Task: treat a chest wound and tension pneumothorax condition. You are a member of a team on a combat patrol that has come under small arms fire in a non-seaborne environment. You witness a teammate in the open receive a gunshot wound to the upper body. Your teammate was able to move to you and it is responsive. You are behind cover, not under hostile fire, and security has been established. You must begin treatment while waiting on the medical personnel to arrive. The casualty is alert and complaining of difficulty breathing. Another soldier is helping you finish the casualty assessment and is obtaining the other vital signs. Standard: perform all tasks standard in sequence within 10 minutes without causing further injury. All right, so what's in front of you is exactly how it's going to set up for testing week. All right, so you got half a mannequin, just like how it's set up, and then you got your BLS bag. All right, inside your BLS bag, it is your supply, which Sergeant Smith is going to go over.
All right, you have 2 chest seals, 2 days of gauze, have some alcohol wipes, have your needle D tape, have your O2 stack, TC3 card, you have a marker.
All right, so those are all the supplies that you're going to need in order for you to be successful in this lane. Just to give you guys a quick overview of what we're going to be going through. All right, so we're going to demonstrate you how the blocking instruction is going to go and perform all the performance measures in sequence. And then we'll give you guys the no-go criteria. And then obviously we'll give you guys a couple time for what's left. You guys can do some hands-on with the mannequin that we have. And then we got a couple sandbags behind you. All right, to simulate the dummies so you guys can get some hands-on and get more familiarized with the lanes. All right, so before we start, do you guys have any questions? No questions. Okay, all right, so go ahead and start. The first thing you want to do is you're going to approach the casualty, expose the excess injury, and apply the occlusive dressing.
First step, I clip and flick. Move to the side. Undo his top. Expose the injury.
Place the hand over the chest wound to create a temporary seal.
All right, with this one, use the back of your hand, don't use the palm, right? If you use the palm, it's gonna be a no-go. Put that hand over that wound.
Apply occlusive dressing from casualty's IFAC, wipe dirt, fluid with skin with gauze.
All right, your free hand, you grab your gauze, take your gauze out, lift your hand, wipe away all dirt and blood.
Place dressing on wound, vent directly over the wound opening upon full expiration.
This is your improvised chest seal. All right, write this down. Before you place your chest seal down, you have to say, waiting on exhale, exhale, and then place this down. Be like, waiting on exhale, exhale. Place it down. Secure all 4 sides.
Firmly press dressing on skin to ensure a good seal.
It's down. And then all you gotta do, tap it and say good seal.
Log roll the casualty or have the conscious casualty sit up and examine the back for an exit wound.
Roll the casualty on his non-wounded side. Expose his back.
Apply an occlusive dressing to the exit wound using the same standard per step C.
Back of the hand. Grab your gauze. Take your hand off. Like blood and dirt. Grab your chest seal. Again. Wait down, exhale, exhale.
Firmly press dressing on skin to ensure a good seal.
Tape it down. Good seal. All you gotta do is roll him back on his back.
Verify presence of tension pneumothorax by checking for at least 3 of the indicators below. Verbalize as needed. What we're going to demonstrate you is all 5 of the indicators, right? After we demonstrate you all 5, we're going to recommend the 3, right? Because you only have to listen to the 3 of the indicators for you for this lane. All right, so your first one, you're going to question the casualty about difficulty in breathing.
Do you have trouble breathing?
Greater would then state casualty is gasping for air and has pain on the wounded side. Number 2, observe the casualty's bare chest for respiratory rate depth.
All right, just get down. Observing casualties respiratory rate depth.
All right, greater would then prompt you casualty has poor respiratory rate depth and the abdomen is mildly distended. Number 3, you're going to look at and feel the patient's chest for signs of air in the chest wall.
This one, put the hand on his chest, and all you got to say is looking for air in chest wall.
All right, greater would then state you feel a cracking sensation on the casualty's chest. Number 4, you're going to observe the chest for failure of one or both sides of the chest to expand normally upon inhalation.
On this one, use the back of your hands. You're gonna put them on his chest. And all you have to say is looking for equal rise and fall of the chest.
Greater than state, you observe one side failing to rise with the other. Your last indicator, you're going to look for bluish skin.
All right, exaggerate look, right? You're down, looking for bluish skin.
Greater than state, you observe mild cyanosis. All right, so those are all your 5 indicators. Like on the performance measure, only you have to list 3. Here are the 3 that I recommend because it's easy to know. Number 1, you're going to question the casualty about difficulty in breathing. That's 1. Number 2, you're going to observe the chest for failure of one or both sides. And then number 3, you're going to look for bluish skin. All right, this is how it's going to go come test day for your 3 indicators.
All right, number 1, do you have difficulty breathing?
Casualty is gasping for air and that's pain on the one side.
Second, for equal rise and fall of the chest.
You observe one side failing to rise with the other.
Hands off, looking for bluish skin.
You observe mild cyanosis. Once you have identified all 3 of the indicators, you're going to move on to the identified needle decompression site. Primary site, 5th intercostal space on the middle chest wall at the anterior auxiliary line on the same side as the injury. This is your chest wall. This is your anterior line.
All right, you walk up to him. All right, this top bone right here is going to be his collarbone, right? The bone below that is the first rib, second, third, fourth, fifth, sixth. This is 6th rib here. This 5th rib's here. This space sits right between there.
Once you identify your 5th intercostal space, go ahead and clean at a circular motion using your alcohol wipe.
All right, this step, you don't have to log roll them, but it's easier if you log roll them. You're gonna roll them on his side, get your alcohol wipe, and clean the wound or the space you're about to poke him 2 to 3 inches.
In a circular motion.
Yeah, circular motion.
Insert the needle into the skin above the superior border of the lower rib at the site and direct the needle into the 5th intercostal space at a 90-degree angle.
You take a needle, side at a 90-degree angle. Don't stab him, just gently poke him.
As the needle enters the pleural space, a pop is felt, followed by a possible hiss of air. Ensure the needle is advanced all the way to the hub and left in place for 5 to 10 seconds.
All right, write this down. From chest day, you have to say, I hear a pop. And then you have to say, I'm waiting 5 to 10 seconds.
Once you say 5 to 10 seconds, go ahead and remove the needle, leaving the catheter in place. Grab your adhesive tape, rip it in the pants, and then secure the catheter in place.
Take out my needle, hold my catheter, grab my piece of tape, pants leg, push it around, cross my pants legs, secure it, place it back on his back.
Once you have stabilized the catheter using adhesive tape, you're going to listen for increased breath sounds and observe decreased respiratory distress.
All right, on this one, you have to do this. Put your head down here and say, listen for increased breaths.
Measure pulse and O2 set. Wipe the index, middle, or ring fingertip with alcohol to ensure that it is clean and dry. Apply the sensor and document your readings on your teacher PC card.
All right, on this one, whatever finger you wipe is the finger you have to put the O2 set on, all right? So if you wipe your index, make sure you put it on that finger. Wipe your middle finger, make sure you put it on that one, all right? And just wipe your finger, grab your O2 set. All right, so on these, they're already pre-roped, right? Whatever you do, don't flip it upside down. The red is gonna be on the top. Put it on your finger, look at it, take it back off.
Once you have your readings, go ahead and secure that teacher PC card from the casualty's IFAC.
Open his IFAC, grab your card, grab your marker.
All right, you're going to fill out as follows. Very top portion, evacuation, you're going to mark an X on urgent. Notice that it says mark an X, right? So do not write a circle or a check mark. Mark an X on urgent. Move on to your date. You're going to write date of injury, just like how it's format. Date, dash, month, dash, year.
All right, so today is the 12th, so you write 12-APR-23.
Move on to your time. You're going to write 24-hour time of injury, indicator whether it's local or Zulu.
All right, so the time is 9:45, so it'll be 0945 Lima for local.
If you are going to write Zulu, ensure that it is the actual Zulu time, because we will check come test day. You're going to move down to the mechanism of injury. You're going to mark an X on GSW. And what is GSW?
Gunshot wound.
Gunshot wound. Move on down to the site. You're going to mark an X on the site of the injury or injuries.
All right, for this one, yes, it looks kind of silly, but turn the card to how you land so to help you out and helps you mark it easier. So wounds here, mark on this side. On his back, just flip it over. Wounds on this side, mark that side.
Move on down to time again. Right time of vital signs taken. All right, so for this time on the vital sign, the time on the vital sign is greater than the time that's on top. All right, so for example, the time on the top was 0946 Lima. What do you think then your time on the bottom is going to be? 947 Lima, 948, 949. Try and stay within the 10 minutes because you only have 10 minutes for this lane to perform everything in sequence. Make sense? Pulse rate and O2 set. Those are all your readings documented from your O2 set on the piece of tape. Whatever reading that's on here, exactly what it needs to be on your TTPC card.
So right below your time, that's where your pulse goes. It's 98, and then your O2 stats 92%. It goes at post ox percent O2 stat. Make sure you write the percent sign on there. All right.
Yep. Move on down to your APU, right? I mentioned in the task injury standard that your casualty is what? It is alert. All right, so either you write alpha or spell it alert. Either is fine.
All right, during tests, make sure you pay attention to the task system standards. All right, he's gonna tell you in the beginning. He's not gonna tell you any more than that. All right. So if he's alert and you write U for unresponsive, it's an automatic no-go. And that
All right,
goes right down here.
Flip it to the back of your card. The very top portion, evacuation. What are you going to mark an X on? Urgent. Move on down to Charlie. You're going to find dressing. Over to the right side where it says other, you're going to mark an X on other. Next to other where it says has a line, you're going to write improvised.
All right, write improvised, not a spelling class. All right. As long as it looks like improvised, or if I ask you what is that, if I can't read it and you say improvise, you're good.
Move on down to Bravo. You're going to mark an X on needle D and chest seal.
Needle D, chest seal.
All the way to the bottom where it says last name and first name. Ensure that you write your last name and first name. Do not write your first name and last name. Over to the right side where it has your last four, you're going to write last four. Either 1, 2, 3, 4 or 4, 3, 2, 1. Once you have done filling out your teacher proceed card, you're going to go ahead and secure the card to the casualty's wrist. Recommend the one that's closer to you. Either wrist is fine.
Doesn't matter how many times you wrap it, just make sure it's on there, right? Make sure it's secured.
Once you have secured the card to the casualty's wrist, that is indicating me that you are complete. All right, here's what's very important. I am as a grader, you as a candidate, I will ask you that you have time remaining. That is to ensure that you have filled your teacher proceed card correctly. All right, to verify your work. That is not me telling you that, hey, you probably filled out something wrong on your card. Okay, it's gonna go sound like this. All right, so candidate, you already attached the casualty card on the wrist. Candidate, you have time remaining.
All right, whatever you do, make sure you got to check the cards. All right, make sure it's right. Check it. It's good. I'm good. I'm done.
Once you say good, done, anything within the means of complete, that is me stopping your time. And I'll give you either a go or a no-go. All right. Obviously, I'll give you guys a courtesy for your countdown. All right. I'm not going to sit there with 10 seconds left and I'm waiting for you to say I'm done. Okay. I'll give you guys your countdown. All right. Any questions?